I love my counterparts in the medical world, but sometimes I hear some things that just make my head spin. I had a new patient quite some time ago come in, and she had told me that her neurologist told her, or it may have been neurosurgeon, that she absolutely must not do things like horseback ride, okay, or exercise or even stretch, because doing so could risk her becoming permanently paralyzed. And I'm thinking to myself, oh boy, okay, okay, so I've got a time bomb in my office here. I got to be careful. So we took some imaging on her, some 3D CAT scan imaging, and what I saw was, the most unremarkable spine of a woman in her early 60s. I mean, really, nothing going on there, and I was puzzled. So on the next visit, I went over these images with her, and I said, "Do you have the MRI that these doctors took that made him say this to you?" And she said, "Yeah, I can get those for you." And I took a look, and it is the most conventional case of cervical spinal stenosis that you could possibly ask for. If you don't know what that is, the spinal canal, that your spine is a canal. It's one big tube, and it's made up of a bunch of little rings of bone, your vertebrae. And spinal stenosis is when the inside of that canal is shrinking a little bit, and it's shrinking. In the overwhelming majority of cases, it's shrinking because there's degenerative change going on, the bone kind of breaking down a little bit, the tissues within there are becoming enlarged. All of the things that happen with the video I just made a couple of weeks ago, that arthritis versus arthrosis video, which got quite a bit of buzz, that's the process that leads to this narrowing. And she was told because of this, basically don't move or you could be paralyzed at any moment. And I don't think that's true. I haven't read that anywhere in the literature that that's something that happens. And in fact, for a person like her, stretching, one of the things that she was told not to do, is one of the most classic treatments for it, and can really help alleviate a lot of the symptoms that are involved with this. So it just really puzzled me. But now they want her to do surgery to correct this. And I pulled up, just for fun, some of the surgical guidelines, and I was reading from the I think the Spinal Surgeons Association of Britain, the British Association of Spine Surgeons. Right in their guidelines, it says that after surgery, some patients may regain some feeling. So already this is not sounding good. After surgery, some patients may regain some feeling, some improvement. There's a list of things here. Modest improvement is possible. Just a crazy list. But then at the end of this, it says, if the surgery simply prevents the progression of the spinal cord damage and there is no loss of function due to the surgery, both the patient and the surgeon should consider it successful. Okay. That is their outcome goal. Basically, it says if the surgery doesn't make the patient worse, then the patient and the doctor should both consider it a success. Oh my, that is crazy. And that's only looking at the raw structural situation going on here. There are so many more, elements involved. This is the static aspect. There's a dynamic aspect to the stenosis going on, not the least of which is what we talked about again in the arthritis arthrosis video, kind of the breakdown, the degeneration that can really be improved upon. The overall structure of the spine can be improved upon. And again, the stretching, which that's one of the main goals, is to improve that overall structure of the spine and function of the spine so that there isn't as much tension and pressure on the nerves that go through there. Why, in the presence of these options, they're pushing for surgery is beyond me. Now, there may be certainly some extreme cases where that's necessary, but again, to tell a patient, to do essentially the things that would help you, if you did those, you might be paralyzed for life, is to me just crazy fear-mongering, and which is unfortunately so characteristic of the medical paradigm in general. And that's really the purpose of me making this video here. No, I'm not going to get up on the table and demonstrate all these stretches for you. I got some comments of, well, I'd like to see some treatment options in some past videos. It's not what these are about. You can get on YouTube and search for stenosis stretches and exercises. You'll find hundreds of videos already done. I'm not going to reinvent the wheel, and they're all safe and perfectly fine to do at home, and they can help people a lot. But this fear-mongering and this idea that surgery is necessary, this idea that if you move just the wrong way, you're going to be paralyzed for life. That's unthinkable to me that that's how we operate. The total opposite of the chiropractic paradigm, which is, as I say again and again, a life without fear, where we can really trust in our body's ability to heal, to overcome these kinds of obstacles. Maybe, we're in our 60s and we have a lifetime's worth of degeneration, breakdown, unaddressed past traumas. Okay, we may be struggling at that point to regain 100% function. Maybe even under chiropractic care, that person were only maintaining and not progressing further down that rabbit hole. Still, that's a better way to do that than surgery, rather than ripping things out from our body. Just getting it to function the way God intended it to. Getting to the root of how it ended up that way in the first place is, to me, the only sensible way to go. So I hope this makes sense to you. If it does, please like and subscribe to our channel. We need to climb out of this pit of despair that the medical world is making for us. I mean, this poor woman in tears, having me pray with her, here in the office because of what she's being fed. I think it's unconscionable. I don't know what the intentions are of that doctor or any doctor who operates that way, but we don't need to live in fear like that. So again, like, subscribe, share this with people, get this message of hope out there, and we'll be talking to you again soon. We got a lot more of this kind of stuff, for better or worse, coming your way.